to make recommendations about opioid prescription, and it's a very serious recommendation. It's at that point when CDC puts their name behind it.
Well, I guess my response would be that this issue is only getting bigger. We're only seeing more people exposed, and that it's something I hope that the CDC continues to pay attention to, because whether it's difficult or not, it's the reality of the people that have drank this water that we face that question every day. When I look at my kids, I wonder every day, are you going to be okay? Or, you're sick again? Is it because you drank the water? So I understand it's a challenging process, but I want you to understand from a mom of kids that have drank this water that I really want to know what I can do now to keep them safe and not just wait until it's not a difficult task or it's, I think we need to err on the side of caution here. And that's one of my frustrations, is that I feel like we give the chemicals the benefit of the doubt. We don't give public health the benefit of the doubt when it comes to these chemicals.
And I understand that frustration. I will say that a year or so ago, we actually had a recommendation in writing that said we don't recommend medical monitoring. So at least, we've taken a step to a more neutral posture at this point. So that's, I think, a partial success.
Mm-hmm. Yeah, I think the other thing I'd like to say too is that our community experiences a variety of responses from healthcare providers just here in New Hampshire. Some providers are much more open to medical monitoring on an individual patient and are willing. And then we have other people that are really hitting barriers with their providers saying, I will not provide medical monitoring for you. I've read what the guidelines are, and I just don't think we need to do that. Anything other than your routine annual exams. And people aren't comfortable with that. They're frustrated with that. And that's the other thing. We need something more streamlined, I guess, that why can I get medical monitoring for my children but somebody else can't? And that's something we're facing quite a bit here in New Hampshire.
I understand, and that's important that we hear that. And we'll be as aggressive as we can about reevaluating our recommendations as science evolves.
This is Michelle Dalton, that I also wanted to just piggyback on what Andrew was saying, that my family was actually one of those families that was denied any type of blood testing for my son. He was in utero exposed when I was working on Pease, and then after breastfed, he attended daycare. He has high levels of these contaminants in his blood. And just recently I went for his annual exam and was talking with the physician, and the physician said, basically I needed to educate him on what these chemicals were and the C8 health study and what their potential health effects were. Long story short, we had about an hour conversation that kind of turned into debating over whether or not we should be monitoring for these types of, potential health effects. And in the end, he said, I'm going to review all of the materials from ATSDR, from New Hampshire DHHS, and I will give you a call. He called me a few days later and said, no, I'm not going to recommend them because I'm going off of what the recommendations are from higher ups.
Was he aware of the C8 study medical monitoring?
I did tell him the C8 study medical monitoring, and his response to me off the side was he needed to make sure that that was a legit website because he had never heard about it before. So
I think you could really reasonably reassure him it's not illegitimate.
that's what I was trying to tell him. But anyway, so I was denied. My son was denied any type of future monitoring, and what really got me was that the amount of time that he took debating and researching and pushing back other patients and making them late for their appointments probably cost more money than him writing the script and saying, okay, I understand, your concerns. This is, here's the blood slip to do this, or the lab slip to do it. And so his decisions were based off of the physician guidance. Go ahead.
This is Elena Davis. So I've had the same experience when I went to my physician and actually produced my son's blood level results and then followed up with them to say, could you please, have a conference with me about this. It wasn't as long a conversation as Michelle's. And it pretty quickly went to the annual exam will cover it. The New Hampshire Department of Health and Human Services doesn't make any recommendations regarding this, and we aren't going to do anything additional. So the state stance has been clearly stated at several different meetings across the state, not just Pease, that they don't believe that the C8 evidence is conclusive enough to warrant any additional monitoring. So I'm not sure if you're aware of that, but it is a struggle that the community has here. It's a struggle that the Merrimack community and other surrounding communities that have contaminations have. And so that's why we keep coming back to you on this, because the state itself is not supporting this cause for us. And so we need to turn somewhere else where we can get that authority to decide that this would be valid.
I understand it. It's important to hear the frustrations you're having.
Can I ask, what is ATSDR's position on the C8 health study? Is you view it as a valid scientific study, and also what are your thoughts on the medical monitoring tool that came out of that study?
So I don't think we, as a policy, we comment on the validity of any one individual study.
Well, can I say something?
Yeah.
Okay. I mean, it's a group of studies. It's not just one study. And the three people who reviewed the literature, and they not only reviewed the C8 studies, but also the occupational studies that have been conducted, studies done in other countries, and so on. So they looked at all the evidence that at the time and came up with a decision as to whether there was a probable link with the exposures at the PFOA exposures in particular in the C8 area and and a whole bunch of endpoints. And so the probable link meant greater than 50%, or more likely than not, similar to what we tried to do at Camp Lejeune. So it's not. It was done because of a legal court case, true, but that really has nothing to do with the actual assessment. The assessment was done in the usual way assessments are done, looking at all the evidence from all the studies, including the C8 studies, and coming up with a difficult, oftentimes, decision as to whether the evidence was from all those studies reached more likely than not level. I don't think they felt that any of them was conclusive, such like TC and kidney cancer, but they did, several endpoints were reached that level that it was more likely than not in their opinion. So that's how it should be described, as a group of studies, but the assessment done by the three panel scientists was an assessment of all the evidence that was available at the time.
And this is Lena Davis again, so I just want to point out for those that don't know this, that the reason why we look at the C8 study, I mean, for many reasons, as we're looking at it for guidance, is because that study studied 69,000 people for PFOA at 50 parts per trillion for a small amount of time as a year. And the Haven well, when it was shut down, was 350 parts per trillion. That's 7 times the level that the C8 study was studied. So if they're finding probable links at the 50 parts per trillion for as little a time as a year, and the people at Pease were exposed for several years, decades even, and some, probably for some people, that's a huge concern. And so, I mean, for people that don't know that, that's why we keep going back to the C8 study. I mean, it was a large population, it was peer-reviewed. Yes, it was a result of a legal settlement, but both sides, both the prosecuting side and the defense side, had to decide on these epidemiologists and these scientists, and they had to both agree on whether that was a valid approach and the people that they chose were okay. So I just wanted to give that as additional feedback.